And good morning. We are going to get started on time. So welcome everyone to the 2025 New Mexico Heat Summit. My name is Paul Charlton. I'm an emergency medicine physician, proudly living and working in Gallup, New Mexico. I'm the chair of Healthy Climate New Mexico, and to each of you, I want to say thank you. It really is an honor to be here with so many committed people this morning to learn about heat in New Mexico and what we can do to keep ourselves, our families, and our communities safe. We all have a story about what motivates us to care about these issues and about the values that give us the strength to lean into the hard challenges that we're facing. And we are incredibly fortunate to have Christine Dobbin as an intern who is doing this work with us at Healthy Climate New Mexico. I've been very moved by her commitment to these issues, and I would like you all to be able to hear her story. So Christine, I will go ahead and turn it over to you.
Hello, good morning. My name is Christine Dobbin, and I grew up in a quiet, unincorporated part of Doña Ana County in New Mexico. We were next to pecan orchards, vineyards, and cotton fields, but most importantly, I grew up cradled by the southern edge of the Rocky Mountains. My family always said that these mountains protected us from all natural disasters. That's why we never really had to worry about the dangers of tornadoes, floods, hurricanes. We were protected, but I knew not everything or everyone was. And so in college, I went abroad to study ecology and environmental action in Australia. I spent months protesting the logging of old growth forests and conducting ecopsychology research. I was invigorated and ready to follow the action. And so I asked Uncle Russell, my professor and Aboriginal elder of the Banshin and Wadkamay tribes, what do I do to best address the climate crisis? Where do I go? Well, how can I help? He told me to go home and ask the people of my community what they need. I thought to myself, well, my community is pretty safe. We're pretty protected. I don't really think they need me, but thank you. The very next semester, I returned to my university in Houston, Texas. It was August 2017, and Hurricane Harvey hit. I had seen footage of catastrophes like this on TV many times, but now I was seeing the rushing water right outside my window. Later, walking past abandoned cars and smelling the flood damage of deserted houses. In the aftermath, I watched the death toll continue to rise, not for days or weeks, but for months. The climate crisis felt more tangible than ever, and it clearly meant that human health was in grave danger and in urgent need of protection. So I went on to medical school. Now it was March 2020 and the COVID-19 pandemic hit. This time, as I watched the news coverage of rising cases in my own community, I was in another state rationing supplies furiously and discussing DNRs with patients who were younger than me. Disasters were happening everywhere, and human health was losing. I felt there was only so much I could do inside the walls of a hospital or clinic when there's only so much that the mountains can protect us from. So I followed my internal compass and I came home. I continued my public health education, finally in search of my own community's needs. Cut to 2024, and I'm at Healthy Climate New Mexico's first annual Heat Summit, throughout which I came to appreciate heat as the deadliest climate disaster of all. I heard Representative Thompson ask us to bring our stories and try and move people. I saw what it could look like for health professionals to collectively champion a movement of climate and health equity. Not only were the disasters very, very real, but so are advocates like all of us. Our experience with unprecedented extremes is a shared one. We see that our communities are under-resourced and strained under the pressure of ongoing climate impacts, especially heat. We have the responsibility to respond and uplift the communities that we intend to serve. As we head into summer, how can you help your community prepare? I have a few ideas. You can comment in support of the New Mexico heat illness and injury prevention rule that has been proposed on a statewide level. You can spread the word about Albuquerque's residential cooling ordinance. And of course, we welcome you to join Healthy Climate New Mexico and continue on this movement together. And Dr. Paul Charlton will tell you more about our organization.
Christine, thank you so much for the centering of why we're here today. Let me go ahead and get the slides back up with this. But I think one of the things that I take from what you're saying here is just how much of a difference each person can make individually, and then how groups of individuals coming together in an integrated manner as part of a movement can make a huge difference. And really, thank you for the inspiration on your story of how we're coming here together. For people who are not familiar with Healthy Climate New Mexico, we are a nonpartisan professional group that is working for the well-being of all New Mexicans, trying to help mobilize people to advocate for climate solutions that protect health and promote equity across our state from people with people from all backgrounds. As Christine was pointing out, there are a number of different ways that people can be involved, and there really are opportunities for everybody, regardless of what your background is within the broader health field. You can see the link here on the left for becoming a member of Healthy Climate New Mexico. We really would love to have more folks after today sign up to be part of our health safety leadership training coming up on May 6th. With opportunities for community outreach of really practical things that are fun that we can do to help our communities be as safe as possible. Support the proposed New Mexico worker heat protection rule, as you can see in number 3 there, and then spread the word about the Albuquerque residential cooling ordinance. These are all really exciting opportunities and part of a broader comprehensive package of people working together for the common good. As a And Christine, thank you so much for the work that you're doing. Just like all of the people who are making time to join today, we all have these stories that are motivating us, and it really makes a big difference to be part of a movement that's building here. For me, as a relative 7-year newcomer to the state of New Mexico, I feel the love and the commitment to this beautiful land and the people who have cherished New Mexico for generations. And as the board chair, I want to acknowledge our dedication and our care for this place, the peoples of this land, including indigenous communities and tribes and other people who have made this their home. The work that we're all doing here today is part of our commitment to this care. A huge thank you to the people who have made this summit happen. So all of the Healthy Climate New Mexico Planning Committee members who have put in a ton of work to make this come to fruition. To all of our speakers who have taken time out of their busy schedules, and you'll learn more about each of the speakers during their individual sessions. And to all the Healthy Climate New Mexico members, we're at 275 as of this morning, and would hope to have more people joining as part of this broader movement to collectively work for the common good and try to make a difference. Thank you very much to all of our sponsors for this commitment to our state, to our communities, and to these issues. And I would like everybody to be able to take a moment to be able to see the organizations that have stepped forward to assist in this way. This conference would not be possible without these contributions from this really diverse range of supporters. So thank you all for the assistance with this.